but are the benefits of turmeric and curcumin the same? In other words, can we get the same benefits from one versus the other? And if not, which one should we choose? And also, what can we do to increase the absolutely miserable absorption rates of curcumin so that we get the benefits that have been described in the studies? In this video, we're going to answer all of these questions using research from clinical trials and other human studies. There's a long list of health benefits of turmeric and curcumin, including a significant reduction in pain as well as an increase in function associated with all types of arthritis, a possible protective effect on brain and cognition, a protective effect against colitis and stomach ulcers, an improvement in cardiovascular health, improvements in many types of skin disorders, a protective role in liver diseases, and they may also help prevent diabetes type 2 in combination with diet and lifestyle changes. At this point, there is enough research to suggest that a total of 500 milligrams or less of isolated curcumin per day can be used periodically for exacerbations of any kind of arthritis in a similar way that you'd use a non-steroidal anti-inflammatory drug like ibuprofen, also known as Nurofen or Advil. With curcumin supplementation, you should expect not only a decrease in pain comparable to that of ibuprofen, but you should also get an increase in function of the affected joints. But make sure that the supplement also contains black pepper, because black pepper increases the bioavailability of curcumin by up to 20 times. One note on all of that is that there are many supplementations that suggest much more than the 500 milligrams per day that I recommend. And you need to realize that there have been studies that show that low doses of curcumin have antioxidant effects, while high doses actually have oxidative effects. However, at this point, I personally still use the whole ground rhizome for the other health benefits for a couple of reasons. Firstly, curcumin isn't the only biologically active component of turmeric, and many people argue that those other components play a really important role in the health benefits found in population studies. We do know that curcumin in the whole rhizome is absorbed better than the isolated curcumin, but we don't know about those other benefits of those other components. And the other reason I would choose the whole rhizome in most instances rather than the isolated curcumin is because we don't have long-term studies on the safety of high doses of isolated curcumin. The way I do that on days I'm not having a curry is simply to mix a heaping teaspoon of preferably fresh turmeric, if you can find it, or a 1/4 to 1/2 of a teaspoon of ground turmeric with freshly ground pepper and a splash of pure virgin olive oil. Heat gently for about 1 minute and simply consume it with a spoon along with fatty foods such as avocado, an egg, or a handful of mixed nuts. And I usually take 2 1,000 milligram capsules of fish oil at the same time. This combination can be used along with the curcumin supplements that I've described earlier. With regard to safety of turmeric and curcumin, make sure that all of your supplements are third-party tested for quality and purity, and make sure that you check with your doctor before supplementing, especially if you're on medications such as blood thinners or if you have other medical conditions or are pregnant. If you are consuming powdered turmeric, make sure that you buy it from a reliable source, because some of the powdered turmeric actually contains lead in it. I'd be really interested in hearing the benefits that you've found when using turmeric, and also other ways in which you consume the whole rhizome. Hopefully in ways that don't involve too much work, and also in ways that optimize the absorption of the active components with the inclusion of, for instance, some fat and ground pepper. So post those in the comment section below. Thanks for joining in, and I'll see you in the next video.